Hey, this presentation today is on NAD+. My name is Casey Green. I'm a pharmacist and certified functional medicine practitioner for Revelation Pharma, and today we'll cover all the injectable applications of NAD+ in the outpatient setting. So we'll cover what exactly is NAD+, how does it work, what are the various clinical support uses and benefits, how can it be given, such as infusion rates, amounts and routes and things like that, testing and monitoring best practices, what potential side effects and precautions to look out for, as well as popular clinic protocols for use. So what is NAD+? So it's nicotinamide adenine dinucleotide. It's a derivative of vitamin B3 or niacin, but a different form that's usually created inside the body going through the energy creation processes. It's a natural coenzyme in all living cells, and NAD+ is notably the oxidized form, and it's essential in energy metabolism, DNA repair, and cell signaling, used in many different processes related to aging, DNA, and metabolism. So how does it work? So the oxidized NAD+ accepts electrons to become NADH, and then from there NADH can transfer electrons during the ATP generation process, so where we actually create usable energy from the foods that we eat. It's a necessary sirtuin co-substrate, which is related to many aging processes, whereas this is where NAD+ gets its application as far as anti-aging applications. And levels notably decline as we age, so then that's where supplementation can potentially come in as a good support mechanism. Again, regulating DNA repair, mitochondrial function around that, and energy metabolism are some of the primary things that we look at. And so much research has shown that NAD levels do decline with age, and that's linked to a range of age-related disorders. And increasing NAD levels through supplements or other means has shown potential therapeutic benefits everywhere from anti-aging to metabolic disorders, neurodegenerative diseases. Some of the potential benefits of increasing NAD levels include more energy and better mitochondrial function, looking at all sorts of anti-aging applications and enhanced DNA repair. So in summary, it's a coenzyme playing a vital role in many biological processes and potential therapeutic benefits in a wide range of areas. So what form to use, NAD+ or NADH? So NADH, the chemical is available and you can potentially find some uses. Some studies have been done with NADH, but it is highly unstable, and NAD+ is going to be much more stable as far as chemical storage, and it's what's been used in most clinical studies. And notably, the two forms do stay in dynamic equilibrium once inside the body. So supplementing NAD+ technically supplements NADH through the process in the body. But NAD+, as far as IV therapy and stability, NAD+ is going to be the most common form, and NADH is not typically going to be used for IV therapy due to the instability and low concentrations in the body. So clinical support uses and benefits. So these are the big four here, starting with anti-aging. So since NAD+ levels decline with age, and that's linked to various age-related conditions from cognitive decline, frailty, cardiovascular disease, NAD+ therapy may help to restore cellular energy levels, enhance DNA repair, reduce inflammation, and just improve overall health and well-being in many various ways in aging individuals. Then we've got metabolic support. So NAD+ plays a crucial role again in cellular metabolism. It's been studied as a potential application for many metabolic disorders such as type 2 diabetes and obesity. NAD+ therapy can also potentially improve insulin sensitivity, help support and regulate glucose metabolism, and reduce inflammation. And then with neurodegenerative support, NAD+ has been studied for its potential to slow the progression of neurodegenerative diseases such as Alzheimer's and Parkinson's disease, NAD plus therapy can improve mitochondrial function, reduce oxidative stress, and enhance and support DNA repair, so thereby protecting against neuronal damage in those types of conditions. And then lastly, with addiction support, NAD plus has been studied as potential treatment for addiction, particularly for opioids and alcohol. And the studies and many clinicians we've worked with indicate that it may help reduce cravings and addiction, alleviate withdrawal symptoms, and improve overall well-being in people with various addictions. So administration options, the big ones are here: subcutaneous, intramuscular, and intravenous. So NAD plus has very low oral bioavailability, meaning that when it's taken orally, only a very small amount of the substrate actually enters the bloodstream and reaches the cells where it's needed. And this is because NAD plus is broken down in the digestive tract and liver before it can be absorbed into the bloodstream. Plus, it's a relatively large and complex molecule, which even further limits its ability to cross the intestinal barrier and be absorbed in the body. Nicotinamide riboside is the only form of vitamin B3 that has been extensively and successfully studied for oral use, but it has to be converted to NAD plus in the body. So actually taking NAD plus in that form orally will not really have any significant clinical effects. But NAD plus can be administered via several different injectable routes, as you see here: IV, intramuscular, and sub-Q. IV is the most common injectable route and has the most rapid and complete absorption into the bloodstream. However, intramuscular and sub-Q can also be very effective and preferred by some individuals, or if patients were to take it and use a protocol at home with self-administration, for example. IV doses tend to range anywhere from 100 milligrams to 1,000 milligrams, with anti-aging and metabolic applications leaning on the lower end of that, and some addiction and neurological applications leaning on the higher end of that dosing range. And it's important to note that too much NAD plus too quickly can lead to tachycardia, nervousness, and anxiety in some individuals, because it does ramp up the ATP production and those metabolic processes. So based on that, there's some limitations in how fast or how much to infuse, as we'll discuss later on, but it's generally very safe if done within established safety protocols. As far as testing and monitoring goes, there's no standard lab testing recommended specifically for NAD+, but it is recommended to monitor for the patient's specific health conditions and risks, of course, just as part of practicing medicine, and then primarily to monitor for physical reactions, especially tachycardia and nervousness, which are two of the most common types of reactions that can occur based on what the therapy does. So one potential risk of infusing too fast is flushing. That would be one of the first things you'd see. So they'd have that sensation of warmth or redness in the skin, and they might feel uncomfortable, have high anxiety, or in extreme examples even have a panic attack if too much was infused too fast. So it can lead to changes in blood pressure, heart rate, respiratory rate, particularly if the individual is already compromised with some pre-existing condition related to that. So, and related to that, infusing too much too fast could lead to nausea, vomiting, headache, and dizziness as well. So, but really to get around this, you just need to administer it slow and carefully enough and not use above the recommended doses, which we'll discuss even further here in just a moment. So side effects and precautions, as we just mentioned, your tachycardia, nervousness, anxiety, panic attack in extreme cases, nausea, vomiting, blood pressure increase. So really this is just controlled by limiting that infusion rate and the doses in those recommended ranges, as well as knowing anything the patient might have as far as high levels of anxiety, nervousness, things of that nature, prone to panic attacks, or if they have heart conditions that would affect heart rate, blood pressure, and things like that. So here's some popular clinic protocols that we see very often and have been used in many studies. So intravenous is the most common, with anywhere from 100 milligrams to 1,000 milligrams infused in some sort of isotonic sterile fluids. And you don't generally want to infuse faster than 125 milligrams per hour based on what a lot of practitioners have found. And your 250 to 500 milligram range is going to be what's used for most applications, such as anti-aging or metabolic applications. And then 500 milligrams to 1,000 milligrams is more studied in like the neurological applications or addiction applications. And most commonly, it's going to be 1 to 3 times per week, but some protocols, especially in addiction, might go daily for 5 to 7 days, for example, in the initial phase. Then we've got subcutaneous and intramuscular. Both are up to 100 milligrams sub-Q 1 to 3 times per week. When you go above the 100 milligram range, it just increases the risk of those side effects. And I have noticed in working with many practitioners that intramuscular, possibly due to faster absorption, has a higher risk of those side effects like the nervousness, tachycardia, etc. Whereas subcutaneous potentially absorbs a little slower and alleviates the risk of some of those side effects. So drug and nutrient interactions. While there's limited information available on potential drug or nutrient interactions with NAD+, it does play a critical role in many metabolic pathways, so it's possible that there could be interactions along there. So, for example, alcohol could affect heart rate and blood pressure levels, and potentially have an effect on lowering NAD+ levels. So it could, to some degree, undo or inhibit if someone really wanted to get their NAD+ levels up. So too much alcohol to that extent could be bad for overall therapy results. And then just any blood pressure or heart rate based medications, not that it's a contraindication or anything of that nature, but just something to be aware of, that since especially again higher doses or faster dosing of NAD+ could increase blood pressure and or heart rate, it's just something to note and be aware of if patients are on those types of things, and it just might require additional monitoring in those cases. And then we've got a pterostilbene, which is a polyphenol found in, for example, like blueberries and grapes, and it's actually been shown that it can potentially increase NAD+ levels in the body along with supplementation, possibly due to how it affects metabolism and things of that nature. So NAD+ in summary. So nicotinamide adenine dinucleotide, it's a coenzyme that's in all living cells and plays a critical role in several essential cellular processes, from energy metabolism to DNA repair and cell signaling. And one of its primary functions is as a cofactor in cellular respiration, which is the process of forming ATP, or usable energy. And NAD+ is also a key component in electron transport chain, which is the final step in cellular respiration, producing that ATP. So during that process, NAD+ gets reduced to NADH, which carries electrons to the electron transport chain and ultimately produces ATP, or usable energy. NAD+ also plays a crucial role in DNA repair by functioning as a substrate for enzymes known as poly-ADP ribose polymerases. They use NAD+ to attach chains and target proteins, which helps initiate DNA repair processes in response to damage. So that's part of its anti-aging mechanism. Then additionally, NAD+ is involved in several cell signaling pathways, from gene regulation, gene expression regulation, and maintenance of mitochondrial function and optimal function. There it acts as a substrate with enzymes known as sirtuins, which are involved in many cellular processes, stress response, DNA repair, and aging. So overall, NAD+ plays a critical role in a ton of essential cellular processes, from energy metabolism, DNA repair, cell signaling, and dysfunction of NAD+ metabolism is implicated in many age-related disorders, including neurodegenerative disorders, metabolic syndrome, and cardiovascular disease. So that sums up my presentation on NAD+ today. You can connect with us at sales@revcustomrx.com or reach us at 1-800-547-1399. You can connect with us in these ways as well at revcustomrx.com, info@revcustomrx.com, or you can find us on Instagram or LinkedIn at those sites there. And here we have a list of all of our network pharmacies that provide various services to check out. And then lastly, check us out. Revelation Pharma's YouTube channel has an extensive library of educational IV, IM, and nutrition, and many other types of educational videos and resources for you as well. So again, that concludes my presentation on NAD+. If you have any questions for us, please feel free to reach out.